Chemical peel is a type of resurfacing procedure that we use to remove the superficial blemishes, discolorations, as well as fine wrinkles from the skin of the face. Chemical peels are defined by the depth to which they go within the skin. A light chemical peel, such as a glycolic peel, is one that essentially removes the epidermal layer of the skin. The epidermis is the outermost layer of the skin. It's mostly comprised of dead cells. So a glycolic peel removes those dead cells from the surface of the skin. A medium depth peel, of which there are several types, goes into the dermis. The dermis is that second layer of the skin. Depending on where the problem originates within the skin, so goes the peel. There are medium peels that only go into the upper dermis, and then there are medium peels that go into the middle part of the dermis. So there's many different types of medium peels. The final type of peel is a deep peel. We rarely use deep chemical peels because of several issues, which include prolonged recovery time as well as loss of pigment in the skin. A chemical peel is typically performed in one of two ways. The patient can be awake during the procedure, in which case the burning process lasts typically 10 minutes. After that 10-minute block is up, there is no more discomfort and no more pain after the chemical peel. The peels can of course be performed during anesthesia, but we typically perform those types of peels under anesthesia at the same time that we're performing other procedures that require anesthesia. The peel material is applied usually with a Q-tip or with a gauze, and it's allowed to sit in a controlled fashion for approximately 10 minutes until it goes to that specific depth. And typically nothing else is required in terms of controlling the depth of the peel. The material goes to a specific depth. After the peel is performed, we typically ask patients to perform things such as facial washings and to apply moisture ointments or other emollients on their skin to keep their skin moist while that peeled skin peels off. So there's a very specific set of instructions that we ask patients to follow after we perform a chemical peel. I get the question on whether chemical peels hurt. Chemical peels typically burn while they're being applied, but the burning component of it lasts typically about 10 minutes. Once you get outside that 10-minute block of time, there is no further discomfort. So it's not painful after you leave our facility. It doesn't hurt. You will feel some tightness as that skin begins to peel off, but typically there's very little discomfort, if any, after the patients leave the office. The recovery time for a chemical peel is typically 10 days, 7 to 10 days. That's the amount of time it takes the skin to peel off, and it allows that new fresh skin to come to the surface and be healed completely from the process. Most patients are completely presentable at about the 10-day time period after a medium chemical peel. Because chemical peels are a type of facial resurfacing, they address typically the discolorations of the face, things that we call dyschromias, or they address the fine lines and wrinkles in the face. Many times patients have sun damage, for example, on their face. Sun damage, for example, is addressed with chemical peels because the peel removes that superficial layer of the skin where the majority of the sun damage is contained. The peel results in an even skin tone without any facial dyschromias and a healthier looking skin. Chemical peels can also address fine wrinkles. Fine wrinkles usually originate within the outer part of the dermis. So it follows that if you resurface to that layer in the dermis, when the peel takes care of the skin, the new skin that grows in underneath has smaller or less deep wrinkles. So those are typically the two problems that are fixed with chemical peels. Yes, it can be repeated as often as possible, providing that you allow the skin to regenerate between procedures. If, for example, you have a chemical peel and you choose not to follow up with a skincare regimen and you go back out into the sun and you create more sun damage, you can repeat the peel as early as a year after the original procedure to get rid of the ensuing sun damage. So peels can be repeated as often as necessary. However, I advise patients that after they have a chemical peel, they should engage in a skincare regimen. And the skincare regimen really is what keeps up the effect of the peel for a prolonged period of time. So if you think about it in terms of what the peel does, well, the peel is basically a rebooting of the skin. You're resetting the skin back to where it needs to be. However, you need to maintain the quality of your skin after you have the chemical peel with a good skincare regimen. For example, in our office, we use the ZO product line as a good way to maintain the results of a peel.